Welcome to our second biweekly advocacy updates from Oral Health Kansas. This is our second one during the 2020 legislative session. And my name is Christy Wells, and I'm the Policy Director at Oral Health Kansas. These calls are really an opportunity for us to provide some legislative updates on oral health and overall health issues that are going on in the Kansas legislature, some issues that are going on at the federal level as well, and then an opportunity for education on the legislative process and any questions that you guys might have as well. So to start, I wanted to talk about the Kansas Oral Health Improvement Act. This is legislation that Oral Health Kansas is championing this year in the 2020 session. And it's really a comprehensive oral health bill that will address three different objectives, as well as fix a few minor changes in the Dental Practice Act. So the three main objectives will be establishing a process to develop a state oral health plan, and that will include stakeholder input. Also providing an increase in CanCare dental rates at a level to incentivize dental providers to treat CanCare consumers. We had an increase last year that if you joined us for these calls last year, you heard about that did pass, and it allowed us to increase about 40 dental codes by 6%. But we're looking to provide an additional increase this year to really incentivize additional dental providers to join the CanCare network. And finally, establishing an adult dental benefit in CanCare to ensure that people enrolled in Medicaid can maintain their overall health. So hoping to add preventive and some restorative benefits into the CanCare state plan. We are excited to say that it was introduced on Monday, January 27th in the Senate Public Health and Welfare Committee. And I included on this slide the Senate bill number, which is Senate Bill 349. So soon you should be able to find that on the website, the Kansas Legislature website. It's not up yet, but if you check back maybe early next week, it'll be up. So that is our bill number, and we are working right now to get a hearing in the Senate Public Health Committee, maybe for sometime in February. And then we're also hoping to get it introduced on the House side in the House Health Committee. If you're interested in taking action on this bill, we're currently collecting stories from both patients and dental providers, as well as just oral health advocates who might have stories to share as well, so that we can use some anecdotal data with the legislators and share some stories about how this would really be impacting their constituents and our state as a whole. So we're looking for stories from maybe patients. It could be maybe you found that your dental coverage isn't sufficient to make sure that you can stay healthy. And so if you have any stories on that, if you have stories about finding it difficult to find a dental provider that accepts your insurance, as well as any successes that you've had in finding dental care. From the dental provider aspect, we're looking for, any challenges and or successes that you've had in being a Medicaid dental provider, or maybe what's preventing you from being a Medicaid dental provider. And then also if maybe you're an oral health advocate or you just know someone that has had these difficulties, and if they wouldn't mind, you sharing their story, we welcome those as well. All of the stories will be shared anonymously, so we do ask for your contact information on the survey just in case, we need to follow up on some of, this story or not, but they will be shared anonymously. No names will be connected to them, so I just want to share that. And the link at the bottom is where you can share your oral health story, and you can also send this out through your organization or on social media to collect stories as well. Some additional state policies of interest. Medicaid expansion has been a really hot topic this year in session. So they've had hearings over the past 2 weeks from proponents, opponents, and neutral testimony as well. And then next week the committee will be discussing and taking action on Medicaid expansion. So hopefully our next biweekly call will have an update for you all. It is kind of the normal organizations that testify, in support or against. And then Clean Indoor Air Act. So there is actually a bill in the House right now. It's in House Judiciary, and it would amend the Clean Indoor Air Act to include electronic cigarettes, and that would be in all public places. So they would not be able to use electronic cigarettes indoors if that were to pass. And that was actually introduced by the Office of the Attorney General. And there was a hearing last week on that bill. So we'll see if they end up taking action on that in the next couple weeks. Some hearings of interest coming up. So next week, you will see some bill introductions in House Health, and there have yet to be any bill introductions in that committee. So we've heard that there are quite a few introductions that will be made next week. And we're hoping to have our oral health bill as one of those introductions as well. Also next week, like I said, there will be discussion and action on Medicaid expansion. And then I did want to mention that in Senate Public Health, once they get past Medicaid expansion, we'll begin to see some additional health bills have hearings, including hopefully our oral health bill. And then also we're going to start having some budget hearings in the next weeks as well. Are there any questions on kind of the state legislative right now? All right. So we had someone submit a question, which I'll share the link if you guys have questions moving forward of how you can submit your questions, asking, how to use the Kansas Legislature website. And so I wanted to walk through the website just a little bit with you guys. I won't go super in depth, but kind of the main things that you might want to know and might be helpful. All right, so hopefully you can see my screen now. And this is the Kansas Legislature website. You just go to kslegislature.org. And you'll want to make sure that you go directly through that link. Sometimes if you try to Google things online, it'll take you to a previous legislative session website. You might find like the legislators are wrong, the committees are wrong, the bill numbers are wrong. So try and go straight through the Kansas Legislature website if possible. So on this main screen, you'll have access to all of the House legislators. You'll find where their office is, who the leadership is, the committees. Same with the Senate. You can find all of the committees from this link. So if you're interested in maybe who is on Senate Public Health and Welfare, you can find that right here. So you can see who the chair is, the vice chair, ranking minority member, as well as all of the members. This staff is also important to note down here. The committee assistant is who will help you if you want to testify at a committee hearing, or if you just have questions about, what the committee is working on. You can also find agendas for each committee on their committee page. So this will show, for next week, this is what the committee is going to be working on. And they do generally update these every day if something changes. So you can come back and check on those every day if you would like. And you can also see past agendas too if that's of interest. Sometimes they'll update those with the testimony from certain hearings. If you're interested in a list of all of the legislators, you'll click on this legislator's header up here, and then if you scroll to the very bottom, you can download an Excel spreadsheet with all of their information. It'll have their office numbers, addresses, any information you want. It's probably on that spreadsheet. Another thing I wanted to show you while we're on the website today is how to listen live to some of the committee hearings. We talked about this on our last call, but I wanted to show you guys again. So you just follow audio video down to State House Live and Archive, and it'll pull up a list of all of the hearings that are happening. They don't have any hearings today, as you can see, but you would just click on the committee hearing that you are interested in. And then if you happen to miss a committee hearing and you want to re-listen to it, you can go back to that day, and then they have them all stored on here so you can listen to archived committee hearings as well. Are there any other questions about the legislative website before we move forward?
Hi, Christy. I got a little bit lost. That went a little bit too quickly to find out when the recordings will be made, or if they're going to be videotaped or something that we can watch.
Yeah.
Let me ask, first of all, watching live. I see audio, video. Okay, up on top.
Yep, and then you'll scroll down to State House Live and Archive. And it'll open a new page. And generally, if there was a hearing right now, it would be like down here at 12 o'clock, and it's usually green if they're currently in session and it's live. I think it's green.
So the grid that you're showing me is showing me just the days and the times?
Yep. Yeah, so
Okay.
Let's look at Thursday. It'll be a little more standard of what you'd expect. So this is like all of the hearings that they had on Thursday, so yesterday, and it breaks it down into hours. So if you know your committee that you're interested in meets at 9 o'clock, then you'll want to look at 9 o'clock and you can see all of the committees that meet at that time.
Okay.
And then, so if you are interested in like House Appropriations, which met at 9 a.m. yesterday, you click on that option. And then once you hit the play button, it'll just start, well, there we went. It just starts playing right into the committee hearing. So this is a recorded one from yesterday. Does that help a little bit?
Mm-hmm, it does. Takes a little while to get used to a new system.
Yeah. All right. And there will be other parts as we get further into session that we'll go more into, like House and Senate calendars. We'll show you guys how to read those and how to find those on the website as they start having more debate on the floor in both the House and the Senate. So we will come back to the Kansas Legislature website and talk through some other features that it has as well, but those are kind of the important first ones to know about.
So let me ask again, just to confirm, the two committees that you're following, the Senate would be the Health Committee, and then the House would be Health and Human Services. I think that's the one.
Yes, you are right. All right, well, I'm going to switch back to the presentation. And I wanted to mention a few federal policies that we have been watching and wanted to share with you all today. So we have been working on Medicare dental benefits for quite a few years now. Currently, there are no dental benefits in Medicare. And so there are a couple bills that they're working on at the federal level that include different components of a dental benefit for Medicare. So one is a comprehensive dental benefit that would be in Medicare, And it actually was in a bill that was HR 3, and it passed the House in December. And this was the first time that at the federal level they've ever seen Medicare dental on the floor. And so it set a really important precedent that, you know, Medicare dental is something that our Congress members are interested in. And so that was really exciting. They don't believe that it will be likely to be picked up in the Senate, just with some of the different priorities that the Senate has right now. But it did set an important precedent that we can use moving forward, which is excellent. There is also another bill that they're working on that has medically necessary dental coverage in Medicare. So this wouldn't add a comprehensive dental benefit, but it would allow any necessary dental work that needs to be done for a medical procedure that would be covered by Medicare. The dental work would also be covered then. So, you know, for example, if you were going to get a kidney transplant, but you have infection in your mouth, Medicare would then cover to get the dental work to remove that infection so that you could get the kidney transplant that is covered by Medicare. So that is some progress that we're seeing on the Medicare realm. Tanya, would you like to talk about Medicaid block grants?
I would not, but I'm happy to do it. Hi, everybody. This is Tanya Dorf-Brunner at Oral Health Kansas. I just make that joke because it's this is an issue I think most advocates have been hoping would never come to fruition, but it has. So just this week, in the last couple of days, the Trump administration announced that they will be putting together a Medicaid block grant program for states. The details are still, you know, yet to be parsed out, and we're still learning about it. But I know a few things right now I just want to share with you, and we'll commit that we'll keep following this and keep you posted. And hopefully, if there's any advocacy opportunities, we'll certainly alert everybody about that. The Medicaid block grant program is going to be called Healthy Adult Option. It's going to basically give states the option of using this block grant. Every state doesn't have to do it. The state of Oklahoma already announced that they want to be one of the first to apply for this. It will include, the population it will include is only adults under 65. It will not include traditional Medicaid beneficiaries such as pregnant women, people with disabilities, children, people using long-term care services. So it does not include those traditional Medicaid populations, but it will include adults under age 65. It'll give the states that opt for this the chance to cover, for example, fewer drugs than they would cover for the rest of the population. It would give states the opportunity to impose a premium structure for those adults. And the way it would be administered is either the federal money, the federal portion of Medicaid will be set by some kind of a formula, and states can opt to either have it be distributed to their state in a lump sum or in a per person amount. So there'll be different ways that'll happen. This is something that a number of legislators have talked about, and past presidents have talked about for years and years and years, and have never been able to get it done because it's happening administratively. It's kind of just happening. We anticipate there will be quite a lot of legal challenges. So, this is just the beginning. And like I said, we haven't seen enough analysis yet to really be able to jump into all the details, but it really looks like it's kind of getting at the, to some extent, the Medicaid expansion population. So it's something that we're certainly leery of. The way the Medicaid program works right now is anyone who is eligible for Medicaid, it has access to the services that Medicaid allows, and the states pay between 50% and about 23%, depending on the level of poverty in your state. You pay, Kansas is about 40%. And then the federal government pays the rest of that amount. So in other words, you can keep adding new populations and new people to the Medicaid program, and the federal government and the state both keep increasing the amount they pay for those services for those folks. But this would block grant that and say, no, here's the amount of money you get for this year, for this population, you're done. If you overspend it, then it's all state money you have to spend. So we'll be watching this, and again, keep an eye out in the news. It's going to be a very hot topic in the news coming up, and it's called the Healthy Adult Option. So I'm happy to answer any questions, or at least take down some questions and then find the answers if anybody has any questions.
Wonderful. Thank you, Tanya.
Thanks.
Are there any questions about federal policy? Great. Are there any questions just from everything that we shared today? Or do you have anything that you would kind of like to, learn about on future calls?
Well, it's keeping up with the legislation, and also the opportunities to educate others, because not very many of us focus on dental, more the focus just on the general medical. So that's part of it, about how do we have simple explanations for some of these things that are coming up.
Yeah.
If we want to engage some folks here who are supporters, but have not had the opportunity to dig more into what is going on at the federal and state level.
Yeah, that's
So
really helpful.
I'm just kind of stirring that around. Maybe tips, talking points, or something, because we can look up and study the legislation more, but just how do we kind of boil it down to something more easily, like, okay, this one fellow that I partner with who is helping with the robust work on dental hygiene for residents of HUD housing, he'd be great to be an advocate, but trying to get some of this pulled together, just sort of basic things, would be important. That makes some sense?
Yeah, I like that.
Real quick fact sheet.
Yeah, that's really good feedback. Thank you.
Well, I think that would be helpful also for the hygienists that are working closely with me, and or maybe just someone who could, I have no idea if the dental hygienists as an organization in Johnson County are meeting. That's always been a bit of a challenge for the hygienists to keep an association going. But it might be useful for the faculty, the key faculty at the dental hygiene programs.
I agree. That's great feedback.
It's a lot of work, though. I mean, we have to, I don't mean to just kind of dump it on you, but maybe just little experiments that you and I can take and see how that works.
Yeah, that sounds good. We can definitely work on that outside of this.
One of the things that came up, a fellow who lives in one of the apartments for low-income seniors decided to go to a local dentist in Olathe, and had dental hygiene performed through his insurance. And I was chatting with Kathy about it, and she said, well, some of the insurance programs, Medicare insurance programs, have some options where people can use that optional fund for different things: eyeglasses, dental, not sure what all, hearing aids. And I didn't know if we'd done any studies, you had done any studies on, maybe you have, on those alternative health plans for elders that have dental as something they could use their supplement money for.
I don't believe that we've looked into that. Is that right, Tanya?
No, I think we have it at different points in time, but not recently. I think that is really good feedback about something that we really ought to spend some time on and get some data on. Yeah, I think that's a good idea.
Well, it would be helpful. And I'm just thinking about this one narrow group of folks who are living, and we have several of them, maybe 10 of them, HUD-funded apartment complexes in Greater Kansas City or this Greater Johnson County. And to be able to provide just some basic facts for people if they could use that. And I have no idea what insurance people have, but it just woke me up to the issue.
Yeah. I think you're right, Marcia. I think we need to figure out if we can get something like that put together. It surely wouldn't be very hard.
Right. Well, you would have access to the different Medicare insurance plans out there.
Yeah. Okay, thank you. We'll take a look at that.
Wonderful.
This is
Oh, go ahead.
This is very helpful. This is very helpful.
Good. I did want to share that if ever, like, in the meantime, you're always welcome to email one of us with questions that you think would be good to be included on the biweekly presentations.
Mm-hmm.
And there's also a SurveyMonkey link that we have as well that we've been sharing out social media and in the weekly Wednesday update. So.
Okay. Thank you.
Wonderful. Well, thank you for joining the call today. And the recording will be placed on our website as soon as we get it pulled off the computer. So.
Okay. All right.
Thanks,
Take care. Good weekend.
You too. Bye, guys.
Bye.
Bye.